What's going on, people? We are back for another episode of Real Talk with Marcus McCoy. Of course, I'm your host, Marcus McCoy. I'm glad to be here. It's been a long month. I feel like I've been gone too long. Today, we're going to be talking about mental health, which I think is a great conversation. We probably need to have more of these conversations. And I would like to introduce my guest who's going to be on here, going to be bringing us great knowledge about this particular topic. His name is Dr. Matthew Christopher Henderson. Welcome to the show.
How you doing today?
I'm good. I'm doing good. Let's tell the people about yourself.
Okay, for those that don't know me, my name is Dr. Matthew Christopher Henderson. Currently, I reside in California. So those that want to get some additional information about me, you can look currently at the LPC board. You can type in Matthew Christopher Henderson. My license number is 0199. For those that want to get in contact with me, later on, I can share when I get fully licensed in the state of California, because I'm going through that. I have my license number for the state of California. But other than that, got a bachelor's degree in criminal justice, a master's. I have two masters, one in I'm so old school. It was called community counseling when I was going through that master's program, but now it's called clinical mental health. Also, I have a master's in school counseling, a specialist in counseling education, and my doctor is in counseling and psychology.
Okay, awesome. Definitely glad to have you here. I got to tell y'all a little backstory about me and him too, so how we kind of connected, right? So we both just happen to be Mississippians, both from Jackson. So that's how we kind of made this connection. We've had many discussions behind the scenes about mental health and what that looks like and what it means to our community. So with that being said, we're going to go ahead and dive into the conversation. So from your vantage point, what are some misconceptions about mental illness?
You know what? That's a good question, because I'm just going to state some. When I was talking to my patients, these are some general misconceptions that people have against mental health. The top priority is they say if you don't have a mental health diagnosis, you don't need to seek mental health services. That is a myth. Also, they say if a person have a mental health condition, that means that they have a low intelligence. They are unable to problem solve. They are unable to have the ability to be able to manage, their daily functioning. One thing that I that is not true. And the last misconception is, and this is for people in the spiritual realm of things, that you turn all your problems to God. There's a reason why we have services and resources out there for people who struggle with mental health conditions. And so those are some general exceptions that I hear about mental health treatment, especially in the African American culture.
Okay. So what are cognitive distortions?
Okay, cognitive distortions, those I'm gonna break it down. That's like an internal mental filter. And basically, these filters can come from your life experiences, where you form some biases based off of your life experiences, and it increases your mood. So therefore you're finding yourself being miserable all the time. That's when you're finding yourself having these different anxiety attacks. and it makes you feel bad about yourself and about your ideal perspective of life. And so that's why they call it cognitive distortion, because what it does, it replaces the positive aspects of life and you replace it with the negative things that you experience.
Oh man, that's deep. I definitely appreciate you sharing that. I had been kind of looking up, reading up on it, so I had my own interpretation of it, but I wanted to make sure I got it from the man himself. All right, so what are the main, I guess, main disorders in African American adolescents?
The number one main disorder I'm going to tell you from working in the schools, and those who are watching, who are in the school profession, they will attest to this, especially when it comes to special education and IEPs, ADHD. For those that don't know what ADHD is, that's attention deficit hyperactive disorder. A lot of our kids are being diagnosed with that. Now we're seeing more. Back in the old day, it was ODD, which is oppositional defiant disorder, but now they're getting the diagnosis of IED, and that's intermediate explosive disorder. Sometimes you can see kids that have a conduct disorder. That's when it's beyond oppositional and it's more behavioral based to where they can be an endangerment to themselves or to somebody else. PTSD, post traumatic stress disorder. A lot of kids are getting GAD, that's generalized anxiety disorder. And lastly, which is something that is more prominent now in this time of day, is major depressive disorder. But if you want to do a comparison back into the old days when I was in school, a lot of kids were not getting the major depressive disorder. They was not getting depression. They summarized everything under generalized anxiety disorder. So it's good that they're kind of breaking these things down now, because our kids are going through a lot, and we are seeing a lot of the suicide rates matriculate higher in the school districts. So it's good that they finally have this diagnosis. So therefore, it can accommodate and meet those particular kids' needs.
It's kind of ironic that ADHD was one of the first ones you mentioned, right? So I'm a pretty private guy, but a lot of my friends they know. So my one of my sons actually has ADHD, right? And I remember he got diagnosed. He's a teenager now, so he got diagnosed with it when he was I want to say like in the third grade, right? But there's so much I want to say lack of information. A lot of times we as adults we're misinformed and we're not educated on a lot of different things just because we have not been in the realm to deal with it yet, right? So I remember when he first got diagnosed, I was kind of in denial. I was like, man, my son ain't got ADHD. There's nothing wrong with him. He's just hyper or something like that, right? Until a week went by and he was like, every time he looked around, I had to go to school because he was under the desk or he was doing something, or he couldn't sit still, he was fidgety. So I thought that kind of just doesn't from my own personal experience, just seeing how my son has evolved from the diagnosis to now kind of just really speaks to what you're talking about, because he's not, he's probably one kid in a long line of kids that, especially the African American kids, that have been diagnosed with ADHD. And matter of fact, he had ODD too, oppositional defiance disorder. So just to hear you say it, it kind of reinforces that like this is a real thing, and that obviously knowing that we've taken steps to ensure our son gets better moving forward. Now I'm gonna kind of spin the page on this because we are talking about adolescence, and me and you had
Mm-hmm,
this conversation too, right? So
mm-hmm,
we say I've said this many times that when I was growing up as a child, I was in a sense taught to repress my feelings. I couldn't show emotion. I couldn't be sad. I couldn't cry. There was nothing that was ever so big of a deal that I should be, showing emotion about. So I feel like growing up as a black man, you hear all that stuff, and you basically I feel like you're being taught that you always got to be strong. No, you can never show an emotion. You always got to, and so like, how do you feel? How do you feel about that statement? And have you had that experience growing up as a child as well?
You know what? I tell people all the time, I just feel like that is just a bias when it comes to, especially men of color when it comes to masculinity. That is a bias that they have. You're less masculine when you show an emotion. You're less masculine when you're vulnerability. But however, I have to say to people that you're human. One way that we release the stress that we deal with on a day-to-day basis is being able to express an emotion. That's you
Mm-hmm.
having a conversation with someone. That's a release of an emotion. You may not be crying, but however, you have to be vulnerable enough or in tune with your emotion to be able to verbalize what is bothering you. And so for me, growing up, I used to hear like, you better not cry, you better not show a sign of weakness. But for me, it was my outlet. And I was a nerd growing up. And so what helped me be comfortable with showing my emotions is I did research. And I didn't even know this until later on in my adulthood, that actually when you cry, the medical terms is that you release oxytocin and endorphins, and these are chemicals that make you feel good, both physical and emotional, when you release those tears. And so, thinking from the medical aspect of crying and showing emotions, I didn't realize that. And so, when I talk to people, I do give them that kind of medical term too, because it's self-soothing. What you're doing is you're regulating your emotion. And so you're not bottling everything on the inside to where it causes a strain on your physical aspects, is that you're able to self-soothe and release that stress. And so that's why it's very important to show emotions, but don't equate emotions with being inferior or being strong or being masculine. We have to stray away from that, because that is, to me, that's a distortion. That is a distorted view. And it goes back to, people of color being oppressed. And so a sign of weakness is that oppression. And so we have to move forward, because we've been through a pandemic. There's a lot of grief and loss. We've been through so much that we were not ready for. And so if you don't allow yourself that time to release that, you're only going to cause more mental health impairments within your
Okay, okay. So look, man, I want to ask this. So we talked about like how we were, brought up as children, right? So now I'm gonna kind of talk about to the social influence and how it kind of affects like mental illness, right? So obviously the world we live in has created these different, I don't know, I guess I would say norms to how people feel like a person should act, how they should conduct themselves, what type of jobs they should have, what type of person they should be dating, the lifestyle, all these type of things, right? So I'm gonna use myself as an example, right? So
Mhm.
in this type of industry, right, there's a lot of expectations that are placed on you when you're in this type of space, right? That like you're supposed to do X, Y, Z, right? This is the code, and you're supposed to follow it, right? So socially, how do you feel like those type of entities or that type of influence like affects a person socially? I mean, from even a negative or positive standpoint, whichever way you want to spin it.
Huh. Okay, so I'm just going to say this. When it comes to that, I say the pop. I'm going to say the negative. I'm going to talk about from the negative aspect. The
Okay.
negative aspect is that you're limiting yourself of living in purpose. Number one, I feel like when it comes to a person being successful, because one thing I don't do is I don't give my interpretation of success, because success looks different from everybody. And so
Mm-hmm.
for me, I can't give a general definition of success. But however somebody wants to look at success, you cannot equate what you got going on if you do not define your purpose. If you're allowing other people to define your purpose, then what you're going to do is you're going to get lost in that transition. And so some
Okay.
people, they feel like, okay, why am I stuck? Or why is it that I feel like that I can't move? That's because what you have done is you have allowed other people to dictate certain things in your life to where that became your norm, but you don't have meaning and purpose attached to it. And I can give a prime example. This is something that I shared with you. You
Mm-hmm.
know, I've always wanted to be an actor. That was something that I always wanted to be. And so growing up, I always heard, being a person of color, you ain't gonna make it in that industry. It's not a lot of money. It's a lot of hardships and struggles you got to put into. So I equated people personal perceptions about acting and made that my perception. And so what it did, it overshadowed what success looked like for me. And so I went the traditional way of saying, you know what, I need to go to college, I need to get an education, I need to have a major. And then once I'm done with it, you can have a lot of money, but there's no fulfillment behind it. And the
Mm-hmm.
fulfillment comes from the lack of me walking in my true purpose. And so when I talk to people, I have to say it's okay to take advice from people, but you as an individual have to create that narrative. Now, that's going to be the positive aspect of it. Being able to listen to what other people have to say and make your own interpretation of it to where you define what it's going to look like for yourself. So that's having that coaching, that's having that support. I tell everybody you have to have a support system. And so having a support system is being able to allow them to vocalize some things. We call that words of wisdom. But however, it's going to be left up to you to take what you need to take from it and apply it in your life, if that makes sense.
Absolutely, absolutely. That it's funny too, because again, I know again we don't have many conversations, but I know I told you that my path. I did some abs in the drama club in middle school. I always had aspiration to be in TV and radio, but again, and I would say for me, it wasn't necessarily that somebody else I was buying into what somebody else was saying, but I had other obligations. I had a son at 19 years old, right? So then, a lot of the time, you had to put things on the back burner. You had to do what you need in order to be able to do what you want. Um, but like now, being in this space, I actually feel like wholeheartedly I'm walking in my purpose because I feel like my gift that God has given me is to be a communicator, whatever that looks like, right? And so when I get to do it, it's like, oh man, like it's real fulfilling. Like I go back and I look at the tape and I do all this kind of stuff. But definitely I feel like walking in your purpose is something that I feel like everybody needs to hear because we listen to all this outside noise and somebody tell you to go left, somebody telling you to go right. But a lot of times, like you said, what you want to do is being overshadowed because you're taking what somebody else is saying and now that you're giving them their words are having more power over your life than what your actual purpose is, right? So I think that was a very good point that you made, and I hope the people that are listening, kind of take heed to it, because I mean we only have one, we gonna get one shot at this thing to do it, right? Me and you are a prime example. We got into the fields that we really actually wanted to be into, kind of later in life, right?
Right.
Like I call this all the time. I said, man, like this is my second career. I've been a correction officer. I don't work private security. I served in the United States Army, and now I'm fortunate and blessed to be able to do this on this particular space. So for African American adults, right?
Mhm.
Um, what are the main disorders for African American adults?
Now, this is where I do my advocacy because being in the mental health field, a lot of times African Americans, adults, the number one, I'm gonna rank them in order. The number one disorder that mostly African American adults are going to receive is schizophrenia. After
Okay.
schizophrenia, they're going to go more into the personality disorders, which is bipolar. Then from that point, they're going to get a current diagnosis. That means a dual diagnosis where they have a mental health and then they have a substance abuse. whether it's an opioid abuse, whatever, or if it's drug related or alcoholism. That's where this addiction come in. And so for me, as a black male, I like to advocate because a lot of times the system is not always built or designed to help people of color, meaning that they don't look at the lack of resources growing up that we had to go through and the adversities that we have to go through. So a lot of times what people have to do is they use their survival skills. What
Mm-hmm.
is it going to help me to make it through the day? Some people do go into the substance use because guess what? It's taking them or that drug of choice is eliminating the problem at that time. So when it comes to the brain development, it's teaching the brain to, if you want an immediate release, this drug of choice is going to do that. And so that's what they do. And then they get that addiction to it because it becomes an addictive behavior because what it's doing is giving them that immediate release that they need. And so what they do is they increase the intake so they can be able to function throughout the day and not having to deal with those life stressors to where it becomes that disorder. But a lot of times, I feel like when they do the assessments with, especially African American males, they don't look at, okay, what was the childhood trauma behind this? Like, what was the root of this? All they see is the presenting problems, and they want to go and give them that diagnosis. And so, you're right. When someone see a person who has schizophrenia or bipolar, you know what we do? We associate those people as being the homeless people,
Mm-hmm.
and those are the people that's living on the streets. And so for me, a person who has schizophrenia don't always have to be homeless. You know, I feel like people of color get that more than a person who is Caucasian because there are more resources that are out there for them to manage. Where if I come from a childhood to where I had a lot of abuse and I don't have a support system, what I'm going to do is I'm going to operate off my survival skills. And that's where a lot of times we go into when we don't have those resources. We do the best that we can do to manage. And a lot of times, drugs are associated with kind of eliminating those particular feelings that we don't want to feel. And it's unfortunate, but that's when I advocate because we need to get to the root of it. So therefore they can get the proper diagnosis and the proper treatments than what they're just seeing at this particular moment.
Okay, okay. So before I say this, I'm not bashing the United States military, but I gotta say this because it's my own experience with mental health, right? So I remember I joined the United States Army almost 20 years ago, so 2004, right? And first time went to Iraq, obviously, there are things that happen that are not the greatest, right? But I remember during that time, and before I say this too, the military has gotten a whole lot better with this particular issue that I'm about to say. Um, but when I was in the army, mental health was like I don't know, man. It was like something that you take and you put it in the closet somewhere and you just leave it there. Um, there were things that happened amongst the people I served with, even myself, and I just remember it being a thing where like it was really frowned upon, where like if it was almost to the extent if you had mental health issues, you were less of a soldier because now instead of just dealing with normal everyday soldiering type activities, now I had to deal with this male or female who is now dealing with PTSD or maybe they some type of depression. Um, but I say that to say this is that type of thinking and the way the realm of how everything was made it to where people did not want to express that they had issues, right? So then you start having these high level, high amounts of suicide. Then we had domestic violence. We got the abuse of alcohol. We got people having to go to get treatment for these different things, right? So in saying that, why do you think and I think some of this is going on now, and I'm not just talking about the military. I'm just talking about general now in life. that people, they don't want to let somebody know that they do have something going on because they feel like they're going to be looked at as less than what they are, right? So they keep it to themselves. So why do you think that people don't go get the type of help they need based on that premise?
Okay, I'm gonna start off with statistics say, and then I'm gonna go off of my personal opinion. Statistics say the reason why people don't do go out to mental health treatment is because we live in a world of we want to be accepted, and so what America promotes is what the everyday person wants. Everybody wants that traditional lifestyle. And
Mhm.
so people who were receiving mental health service was classified as crazy. Let's just be honest. And that's the
That's true.
stigma that is surrounded around mental health. And so people are afraid to talk about mental health or seek out for services is because they do not want to be disowned by whatever social class or whatever um, persons that may be in their circle. And so it's almost as if they ashamed and embarrassment to
Hmm.
say that I have a condition that I'm unable to manage. You know, what are people going to think about me? So those are the top things that prevent people from seeking out services. However, my personal opinion is number one, I think it's better for people to suppress than actually deal with their things. And so for me, if you're unable to admit that whatever you got going on is interfering with your daily life functioning, then you're not going to seek services. What you're going to do is you're going to constantly say, you know what, I deal with it, I deal with it, I deal with it. But what you're doing is you're piling more things onto you. Some people
Hmm.
like to, and I call it, they like to keep themselves busy. That's another thing. The more busy I am, the less I have to deal with my own issues. So I become a provider. I become that person to support other people because what I'm doing is I'm neglecting myself and my needs and I'm pouring into other people to where that is going to keep me away from having to seek those mental health services because I'm neglecting myself. And so, me neglecting myself is me not being able to look at myself to be aware of the things that I need to work on.
Okay. It's funny you say that. So I'm not gonna mention what it is, but so I'm in some different groups that deal with mental illness. And one of the conversation pieces around one of the last group discussions we had was people that instead of that what they do is the same thing you said, like I'm gonna pile all this stuff on my plate, right? I'm not gonna actually deal with the issue because what I feel like is if I keep myself busy, right, I don't have time to think about what is actually going on with me. And I feel like when people do that, because I feel the situation is still gonna be there, right, until you actually deal with it head on, right? But people do that in not just with I feel like not just with mental health, they do that with a lot of things, but most problems, especially things that deal with your emotions and how you feel have some type of mental health aspect to it. So, like I said, the people were saying they want to stay busy and do all this type of stuff, and I was like, well, hey, man, at the end of the day, you still have to deal with that problem. I don't. I feel like I do that sometimes too. I might not necessarily deal with it right then and there, and so like when you don't deal with it, you had a tendency to have these things just kind of pile up on you, and then maybe it can get overwhelming. But I'm encouraging people not to do that, do the opposite of that, and go ahead and deal with the problem as soon as you can because it will make your life easier. So tell us about some evidence-based interventions that assist with managing mental health conditions.
Okay, you have. I'm going to say the biggest one for children is play therapy. A lot of time people are unaware of what play therapy is. So I'm just going to give like a overall overgeneralization kind of concept of play therapy. But play therapy is basically when your child sits in with a therapist and they use the they use the form of play to teach them whatever skill sets that is needed, to teach them to open up and talk about whatever traumatic experience that they go through. Because you have to think about it. If adults are if it's hard for adults to express some emotions, just think about what it is like for a child. And so
Mm-hmm.
sometimes children, they can use the act of play or the form of play to get them to express what's been going on. And then that's when the therapist can kind of pick up on it and kind of do interventions from that standpoint. It can be
Right.
easier from like if a child was going through some form of abuse, you're just having like little stuffed animals and just asking them, okay, so show us, what's appropriate play and stuff or what's inappropriate. And if they're able to identify those things, then you can formulate those open-ended questions. Have you ever seen anybody do that inappropriate stuff? So it's getting them to kind of open up whatever traumatic experience that they're going through, but using a form of play to where it's a comfortable environment for them to be able to do that. Also, you have behavior therapy with adults, CBT, cognitive behavior therapy, dialectal therapy, family therapy. Um, a lot of times we don't talk about this, but grief therapy. Grief therapy is something that I try to promote. You have holistic therapies for those people who want to go the holistic kind of route. They do have therapy that can get them that kind of treatment. Um, Group components. So group therapy for those who have social anxiety, for those that get panic attacks in like small or large social settings. They have those group therapy components for them to kind of break that. Exposure intervention based therapy. So those are people who have fears, or those people who have things that they really, really, really need to get over. So they use the adventure based kind of exposure therapy to walk them through whatever process that is needed to overcome those fears that they have. And parenting training. I tell people all the time there's no rule book of how to be a good parent, so parenting training for those parents who want to always go and get those supports so they can be the best parent in their eyes to their children and make that connection to where they can provide supports and things of that nature for their kids.
Okay, great, great, great. How do you feel mental health? And I know now, I know we finna dive in when I ask this question. How do you feel mental health affects relationships?
Oh yes, I think mental health affect relationships. I'm gonna say if you don't address your mental health conditions, then it's going to affect relationships in a negative way. An example of that is I say trauma responses. So if there are things that I've been through in life that I have not dealt with, then you're going to get a trauma response, a trigger. That goes back to the flight, the freeze, or the mode. And so that's my trauma response. So if I'm in a relationship and if I'm overly sensitive and and someone say something to me or my girl say something to me and I respond in an aggressive manner, that can be that fight mode. That could be a trauma response, and it's stemming from things that I have unresolved in me that I have not necessarily worked on. The fight if I'm always angry or it comes to that power struggle. And that's when you get into that domestic violence situations and stuff like that. So that means where it was some point in my life to where I felt like I was inferior to everyone. And so I became overly aggressive, and that became a trauma response to me. So for me, mental health can really, really affect your relationship if you have not dealt with your own things. And I tell people a relationship takes two parties. But however, in order for you to have a well-developed relationship, you as an individual have to make sure that the things that you've been through in life, that you have some type of resolution or some type of skill set that helps support you so you can be at your best for your partner. Because one thing I tell people is you cannot control your partner. You never know what is going to arise in your relationship, and that could be a breaking point for you based off of the things that you've done been through in life. And so that's why I tell people, have those conversations with your partners about mental health. Even if everything is looking up in a relationship, talk about those dark times, because you never know what circumstances are going to come in your relationship that you may have that traumatic experience again, to where you re-traumatize from something, and that can be the determined factor of how your relationship goes in the end.
All right. So I think for me too. So I've definitely had some prior to now had some issues in relationships because of mental health issue type stuff, right? So like I was talking, I was giving an analogy of summary about being in the army and then coming back from Iraq. So when I came back from Iraq in 2005, I was a much different person than I was before I left, right? um, Things that I hadn't dealt with, trying to repress memories, all that kind of type of stuff, right? So when I came home, at that time I was married. So the wife I had then, the guy she was married to, I came back and I was like, did a complete 360. Like my personality was different. I would have mood swings but what I did is I became an avoider, right? So I would know internally like I got some real baggage going on, right? But I would just internalize and I would just keep it to myself, keep it to myself. And it even got to the point where like if I would have like a disagreement with her, I would just shut down. I wouldn't talk, right? Which is it's not good either, right? But then I think what I was trying to do is I was trying to not lash out because the issue wasn't really with her, it was what I was dealing with internally. Um, Now, after a while, she convinced me to go and, go see a provider. And then, I've been doing much better since then. And we're talking about this 2005. So that's what, about 18 years ago? But I see just from that vantage point how easy it is to not deal with stuff. I know so many people like me that just be like, you know what? Hey, look, I'm just gonna put it on the back burner. Or and like you said, relationships they suffer as a result of, you got all this stuff going on in here, you got stuff going on in your heart, but instead of dealing with it, we just push it to the side. Um, but oh, and I just want to say this too for the people that's listening. If you didn't know, it's Mental Health Awareness Month. I didn't say that in the beginning of the show, but I wanted to make sure I say that so you understand. Well, to me, mental health awareness is 365 days a year. We're just doing a show on it today. But yeah, your mental health is something that you need to take care of and think about at all times. I want to say we talked. You kind of. I think you used the phrase emotional intelligence. I might be wrong
Mhm,
though. But if you did
mhm.
or you didn't, can you kind of speak to the people listening about like emotional intelligence actually is?
Okay. Yeah, so that was going back to when I was talking about some of the myths of
Mhm.
mental health. And some people feel like emotional intelligence, I mean, yeah, you're less emotional intelligent when you actually seek mental health services. But for me, emotional intelligence is where you become aware. And when you're able to identify the root of things and come up with a plan of action. And I'm just saying it in simpler terms for people who can understand, because when you give out a definition and it's textbook unrelatable to people, so I
Mhm.
just wanted to do it in a way to it becomes relatable. And so
All
that's
right.
when it talks about emotional intelligence, just being able to become aware of what is going on and coming up with a plan of action. A plan of action is meaning like if you not necessarily have to go and seek services, but what is it that you need at that particular moment to maintain? If you going in if it's a crisis and you feel like that you're in crisis modes, there are hotline numbers, Or like Mr. McCoy said, sometimes he did just shut down in his relationship, but emotional intelligence would tell him it's a way. And a lot of people are afraid to use assertive communication when it comes to relationships. But when you're talking about emotional intelligence, you know that assertive communication, meaning that you have a clear, concise communication style to where you're able to get your point across, and you're not passive aggressive or aggressive in your delivery. And a lot of times we are afraid to have that assertive communication, even on jobs, because we fear that they're going to have retaliation, or we feel like that we're going to be labeled, or we're going to be ostracized as being someone hard to work with, because what we use is a form of assertive communication. But I encourage everybody to have that emotional intelligence about you and become more aware of some of the things that you have been through, and what is it that you need to be able to constantly make that change. And for me, my own personal experience when it comes to emotional intelligence, hey, we live in a world that is changing every day. You're not going to be the same person you were a month from now. And so a lot of times when we go through these transitional changes, things about us are going to change. Even though we may be content where we are at this particular time, still, when things change, you have to change. Everything around you have to change. And if you're not making that change, then yes, you're going to find yourself having those circumstances to where you're finding yourself becoming unrelatable, becoming misunderstood, because you're stuck in a time to where life is constantly going through these changes. And if you're not aware of the changes, then yes, you're going to be left behind, and then you're going to be misunderstood. You're going to be frustrated because you're going to find yourself being in a battle of life. And so, just having that understanding is the key component to I feel emotional intelligence is about.
So you kind of actually, I think you touched on a bunch of great points, but you actually kind of brought me to the next thing I wanted to talk about. You mentioned you kind of was talking about different resources. So what are the resources out there for somebody who is dealing with a mental health issue?
Well, I'm going to say the number one, Psychology Today. For those people that don't know their website, they have a bunch of licensed professional counselors that's out there. What it does, it has their specializations on there, so it gives you that ability to find a person that you feel like is going to be able to connect with you and understand you. And while I'm on this topic, that's another myth, is that a lot of people say that therapists cannot help them or cannot relate to some of the things that they go through. And so people specialize in these things, and people have the knowledge base, and some people do have the experiences too. So Psychology Today is something that I think is a good resource, because you can narrow it down based off of what you feel like you need, and you have people that specialize in that area to where you feel comfortable enough. I say EAP programs. I work in quality assurance. I'm a director now in that. And so one thing that I have to do is I have to see when it comes to like hospitals, and when it comes to these different mental health institutions, how many of their employees are actually using their employee assistance program. And so that is something that is not being promoted within different agencies. And that's when I come in, and when I talk to people, I say, you do have an EAP program. And what it is fully confidential. No one, your supervisor, no one within your company will know that you are seeking services. Confidentiality, and that could be a potential lawsuit. But an EAP program, I advise everyone, whatever job that you're working in, ask about your EAP program. That's your employee assistance program, and they have therapists that are connected with your agency that will provide you therapy services, or what they can do is they can refer you out to like a psychiatrist or a psychologist if you need it. I'm going to say the National Institute of Mental Health. That's a good resource. The 988 Suicide and Crisis Hotline, any kind of hotline, crisis hotline, that is good, because what it does is it does an immediate assessment right there. And so, based off of the assessment, they will determine the level of care that you need. Um, they have a veteran crisis hotline for any veterans who probably went through PTSD. You know, it's good that they have a hotline tailored to veterans. And so people, you know, get those resources. And I'm always going to advocate your nearest emergency room. You know, you're not crazy if you go to the psychiatric unit for a couple of days. What you're saying is that you're using your emotional intelligence, saying that I need this time to get myself mentally and emotionally stable. And so breaking that label of a psych unit is only for crazy people, we have to steer away from that. We have to stop putting labels on things and just saying that, you know what, this person is doing what is needed to save their life.
Absolutely, absolutely. And I want to throw one more in there that I know is really big in this area is the National Alliance on Mental Illness. Is another place that you could go to get some resources. Um, so before we get out here, before we come to a close, what do you want to leave the listeners with?
I want to leave everybody with is just saying, let's focus on a foundation, understanding your purpose. Once you understand your purpose, get that foundation. I tell people all the time, you have to look at yourself as a root. Like you can break down the tree, but the root is still going to be there when that tree is broken. And so look at yourself as that root. And what are you doing to making sure that you have that stability that you want for your life? And if it's you just confiding in someone, then do that. But ultimately, if that confinement is to a point to where you're still not getting that fulfillment, then it's okay to say, I'm not okay, and go get the mental health services that you need. And so that's what I want to leave the audience. If you're not okay, it's okay to say, I'm not okay.
Absolutely, absolutely. I definitely want to thank you for coming on here. It was a great conversation. We got to run it back again. I think the thing I want to leave the listeners with is I'm just basically going to echo your same sentiments. Like, like take care of yourself at all costs. You know, especially like from a mental standpoint, because I feel like mentally, if you're not in a good mental space, it's going to affect so many other parts of your life. And then it also could affect the people that you care about, like your children, or your spouse, your friends. Um, don't take your mental health for granted, right? There is help out there. There's all kind of resources. So I encourage you all to go if you know that get those resources. If it's just somebody to talk to, sometimes we just need somebody to vent to, somebody to listen to us, right? But just don't take your mental health for granted. But oh, gotta let you guys know something else before we close. So Marcus McCoy is going to be taking the summer off. So there will not be a show in June. There will not be a show in July. Um, but I will be coming back in August with new guests. Continue to have candid and organic conversations. But until then, El Paso. Until next time, it's been real.